Hi, everybody. Hi. OH. OH. Oh, you have good energy today. So let me ask a favor. Even if you are not super excited about wellness today, would you please act excited for me? Pretty soon, if you act excited, you're going to feel excited, and that excitement and enthusiasm is going to stretch campus-wide. So I want to welcome each and every one of you to our 2013 State of Health and Wellness in Buckeye Nation. We actually started this 2 years ago, and we're going to do something very different this year because we're really going to focus on what all of you are doing in the grassroots to really enhance health and wellness at the university. I'm Bernadette Melnyk. I have the privilege of serving as the university's Chief Wellness Officer and Dean of the College of Nursing. And we will see some exciting clips today that I think all of you will enjoy. We're going to get you more motivated to go out and continue to do awesome things in health and wellness. So we have a big dream, and I am so blessed to work with the most wonderful leadership team here at the University and Med Center, including Larry Lewellen, who you're going to hear from shortly, A.J. Douglas, Steve Pariser is in the back of the room, Megan Andraea, Ben Treese, and all the members of our One University Health and Wellness Council. And we are a group of leaders from faculty, staff, students who really spearhead and are always strategizing about how we can create the healthiest university, not just in the state or the nation, but in the globe. And that's a pretty big dream. However, we are committed to that dream. And I want to show you a clip now of a boy who had a really big dream, and that was he was going to be a professional baseball hitter. Look what happens as he practices every day, but he is so determined to be that professional baseball hitter. Very optimistic about our future here at Ohio State. And not only are we working really hard to enhance health and wellness of faculty, staff, and students, but we're also working really hard to show the nation that we are really leading academic wellness. So in April of this past year, we held the first National Summit on Building Healthy Academic Universities. And that summit was attended by over 300 leaders from over 90 universities and colleges throughout the country. And if you haven't seen the executive summary from that particular national summit, I encourage you to go to the website and check it out because we are really doing wonderful things both university-wise and nationally to advance health and wellness. So we all know that wellness just is not about physical health. It is about 9 dimensions. And I really want to give Student Life a lot of credit. Connie Bain, who does a fabulous job, and her team on student wellness. But they are working very closely with us who work on faculty and staff wellness. So we are all in sync, and we make sure we are doing programming around the 9 dimensions of health and wellness. So what do we know based on the best evidence. I want to assure all of you our leadership team is aligned and we really are moving forward evidence-based strategies. So what we know from the best research is if we all engage in 4 behaviors, we are going to live longer, have less diabetes, less heart disease, and less depression. So what are those 4 behaviors? One is non-smoking, and I'm so excited because we are implementing a non-smoking campus January 1st, or tobacco-free, I should say. There's a lot of universities who have gone non-smoking, but they haven't gone tobacco-free. So I'm really excited that we have gone tobacco-free. Connie Bain and Peter Shields from the James has been leading that tobacco-free implementation. Then there's physical activity. And what's the gold standard in terms of physical activity? It is 5 days a week, 30 minutes a day. That's all we have to do. Sounds simple, doesn't it? But it's not necessarily easy because we're talking about behavior change. You all could just take 3 breaks a day for 10 minutes, and instead of sit, get up and move and walk. You will meet that recommendation. Have standing meetings. In addition to being good for your cardiovascular health, you're going to get through those meetings a lot quicker, which is really great. And then there is healthy eating. What's the recommended criteria for healthy eating? It's 5 fruits and vegetables a day. So again, 4 behaviors. And if you do drink in moderation. And the CDC defines that as 1 drink a day if you're a woman and 2 drinks a day if you're a man. Well, take a look at this slide. It's a fitness facility in California where they actually have the option of either an escalator up to the fitness facility or the steps. So they put a camera crew out there 1 whole day to film how many people made the choice to take the steps. Guess what? 1 individual took the steps instead of the escalator. So what we've been doing at different points throughout the university, we're actually putting visual triggers at some key points. The CDC has a lot of signs that you can do, like by the elevators. Have you thought about taking the steps instead of the elevator? So behavioral choices are choices that we make every single day. I don't want you to look at the fine print on this slide, but I just wanted to share with you, as a strategy, the One University Health and Wellness Council has adopted a socio-ecological model to plan our interventions and our outcomes. We recognize we can't only work at the individual level, but you have to work with individuals, you have to work with the social context, the organizational culture needs to be changed, the environment needs to be changed to make it easy and fun for people to engage in healthy behaviors. So here's how many people, over 28,000 faculty and staff, completed the PHA, and these are just some very preliminary results from the PHA of what people reported on these health indicators this year. You will see from looking at this slide, we have a lot of room for opportunity. We sincerely do. 61% of our faculty and staff are overweight or obese, and about 25% reported that their total cholesterol levels are more than 200. So again, us monitoring outcomes of what we're doing is super important so we can see what's working and what isn't and begin to put quality improvement strategies in place so we can really be the healthiest university in the nation. And this is our structure right now for One University Health and Wellness at the university. We have a One University Council, Larry Lewellen and AJ Douglas, who are going to speak in just a minute, co-chair this particular council with me. But what I really want you to recognize, there's a lot of opportunity for you all to get involved with the sub-councils for this One University Health and Wellness Council. So we have faculty and staff serving on various sub-councils as well as students. It is okay to be innovative and to have fun in academia. And we have to do more of that sincerely, which is why innovation is so critical. All of you had an innovation workout on your table, and we can't wait to get that information back from you because we really do care about you and your input. And I will tell you, the folks from Your Plan for Health, they are super great at being innovative and working together with us, again, on activities to improve your health and wellness. So with that, I would like to call an awesome leader up here on the stage, and that is Larry Lewellen, who is Vice President for Care Coordination and Health Promotion at Wexner Medical Center. I feel very privileged to work with Larry on an ongoing basis on health and wellness.
Now, how do you follow that, huh? Thank you, Bern. I just want to do three things, really. One is express gratefulness. Mariana, that keeps us all healthier just to be grateful, doesn't it? And secondly, I want to throw out a bit of a challenge. And then third, I have a surprise at the end I'm going to use a little bit of my time for. Bern's looking at me like, what are you up to? And so first, I just want to say how grateful I am to work with AJ and Bern. Bern has us on a national stage for Ohio State for Health and Wellness, which has never happened before. I mean, that's awesome. And AJ, her office, the things that they're doing, the wonderful success of the personal health assessment these past few months is just amazing. And the Limeade portal that's been put in place and how people are engaging, I am just so excited about all of that. Creates the foundation for health here at Ohio State. And Dr. Stephen Pariser, as Bern mentioned, we have a physician in the medical center who's dedicated most of his time at this stage of his career to health and wellness. We have never had that before. He's doing wonderful things at the medical center. Thank you, Steve. And to mention, of course, Megan and Bern, who are they're very fast movers. You got to move fast when you're around them, so don't get in their way. They're really wonderful. And I'd like to do a shout out to Nancy Campbell and Pam Dosick, if they're here, who launched into health and wellness well before the rest of us were even thinking about it. And the health plan, as Bern mentioned, and the staff there, Dan Vukmer is our new CEO, all the screenings they do. So I'm just so grateful to everyone for how there's this powerful partnership here coming together to move Ohio State forward. It is just phenomenal. So the challenge I want to throw out, though, and the reason I'm grateful to you as innovators for being here, is that wellness programs have been in place for several years, and they're impactful, but actually people are not as healthy each year as they were the year before. As you notice, as time goes by, health sort of fades a bit. And so our challenge at Ohio State is to be healthier next year than we are this year. That's a huge challenge. I mean, it's one I take personally. I like to say I'm turning 60 next week, which I am, and my biometrics are better. I don't know what you're clapping about. My biometrics are better than they've ever been in my life, thanks to Ohio State, which is wonderful. I mean, my wife would say, you're not any better looking, and you only got 3 hairs left, but you sure as hell are healthy. So, which is true because of Ohio State. I mean, it's just such a wonderful place. And so, but the only way we're going to be healthier next year than this year is at a grassroots level. It's not an ivory tower thing. It's not just a website or a program. It's the fact that people and what they do every day, the kind of ideas you're generating at your table, how do you eat healthier, how do you be more active, you know, in your department, in your office, at home, with your family, with your children, your parents, everyone. It's got to be a way of life. It's got to be a culture. And so you're the only ones who can get us there as the innovators. That's why I'm so excited about this program, about everything you're doing. So we need you. We need you badly. We've got to be more healthy next year than this year and healthier still the following year than that year. That's my challenge to you. It's a big one. And then finally, we have Bern here at the stage. I'd like to ask Megan and Ben to come on up as well. If you could first come up for a little surprise. So I'm being brief in my comments so I can make a couple minutes for this. And now I'd like to ask, I think you have some people that want to recognize you. I'd like to invite Margaret Queen, Jennifer Belisle, Libby Melzer, and Elizabeth Richards to the stage. So look out, Bern.
Hi, guys. Hi.
Margaret, you want to take the podium?
Yes, I would. Thank you very much.
Oh, you guys are going to make me cry.
This is all Margaret.
Don't get me crying.
I'm just making way for
Hi,
it.
guys. Thank you, Larry, for helping make this happen. We'd also like to recognize Dr. Stephen Parisser for everything that he does with the innovators at the Medical Center. How many Buckeye Wellness innovators are in the audience? Raise your hand. Awesome. Bern, Megan, and Ben from Buckeye Wellness innovators across the campus, our branch campuses and extension offices, to congratulate you on a very successful first year of Buckeye Wellness Innovators Initiative, and to thank you for carrying leadership, guidance, and inspiration. Please accept these globes as symbols of our commitment to continue helping you help Buckeye Nation become the healthiest nation in the world. As a symbol of your encouragement to dream big, these 2 5-foot cards, along with scarlet and gray permanent markers, have been hosted across campus by these Buckeye Wellness innovators and BWI Chan White, who could not be here today, so that Buckeye Wellness innovators, their colleagues in OSU leadership, including Interim President Aludo, could have the opportunity to sign the cards or write a message to you. Wherever you decide to place these cards, when you turn off the lights to go home each night, your words, dream big, will remain illuminated. Again, thank you and congratulations.
Well done. No, she's fine. I just made way for it. Thank you. Thank you for letting us take those moments to recognize Bern, Megan, and Ben. Feel free to be sure and sign these cards when you have a chance, please.
Yes, they keep us going. I am so touched, and I can't thank all of you enough because, again, you know, the theme that we're constantly promoting is we got to keep dreaming big. So many people never achieve what they want to achieve because they let negative people around them or they let their fears get bigger than their dreams. And sincerely, we have the best dreamers in the whole wide world here. And we also have people who are going to persist through whatever character builders it takes until we see that dream come to fruition. So thanks so much to all of you. You've really touched our hearts. Thank you. Now I would like to introduce another wonderful leader who Larry and I get a chance to work closely with on, again, making this the healthiest university on the globe. And so I'm very pleased to introduce to you Senior Vice President for Talent, Culture, and Human Resources, A.J. Douglas.
Thank you very much. I'm delighted to be with all of you this afternoon, and more importantly, with some great partners in crime here that I have learned a lot from in such a short period of time. They said to me, "How long have you been here?" And I said, I don't know, let me think. And Bern was saying, well, someone told me 3 months. I was like, well, this has been a really long 3 months if it's only been 3 months. I actually got here in February, but I've been a Buckeye for a very long time. I started consulting with the university about 5 years ago, or maybe longer than that, Larry, on culture. And so culture is one of the things near and dear to my heart. And when you talk about a culture of wellness, and then you talk about spreading that culture across the globe, that's pretty phenomenal. So as I said, I'm delighted to be here, and I'm delighted to be considered a Buckeye. It's about time, as my husband would tell me. One of the things I wanted to talk a little bit about today is that the time we are in the history as a country, as individuals, and as a university, we really need to focus and push forward together when we think about what we're going to do to become the healthiest university on the globe. We are facing some worldwide significant problems. Bern showed you our numbers, which, by the way, we have them. Bern has them at a high level. She does not have individual data. I just have to say that. I'm going to repeat doing that. None of us in this room have that individual data. That's all housed in Limeade. And someone said to me, how did they come up with a name like Limeade? How many of you thought Limeade, right? So here's another way to look at it, right? From an optimistic perspective, isn't that refreshing, right? Right? That's what I was told. Joanne and Nancy shared that with me. So we need to create an environment where we can attract, support, and retain the best faculty and staff that we need to be able to accomplish what we have going forward. As my title indicates, there's a reason why I'm not just human resources. There's a reason why it's talent and culture, because those things are critical to our success. When we think about our history of how we got to where we are today, I was glad that Larry called out Pam and Nancy, because as long as I've known them, they've been focused on wellness. And so it's delighted to hear them being singled out, because they really are critical to our success, at least the foundation of where we started. But healthcare costs are rising, and at an unsubstantial rate. For individuals, for organizations, for the university, and overall, if we think about it as a society, our health is declining. So we're just not immune to this at Ohio State, but we're the ones that are proactively looking for ways to make it better. Costs go up every year, not just for you, but for the university too. And we've got to begin to think about ways in which we can curb those costs so we don't pay more and you don't pay more. We have to look at what we can do about those risk factors and how we can bring down those risk factors. So what do we need to do? Well, one thing I know for sure, and I have data to prove this, is the happier you are, the healthier you are. The happier you are, the healthier you are. So I don't know about you. I've tried, when I'm having really bad days, to walk around and say, I'm going to be happy today. I am going to be happy today. Damn it, I'm going to be happy today. Sometimes it just doesn't work, right? So sometimes it takes a little bit more. Sometimes I have to think differently about it. And so I have a son getting married in 10 days, the 27th. And I have been focused on losing 5 pounds for a dress I bought probably 9 months ago. And so I've tried it, but it didn't work. I said, I am going to lose that 5 pounds. I am going to lose that 5 pounds. Well, it didn't disappear. So I had to start thinking differently about how I was going to get rid of that 5 pounds, or have to break the news to my husband that I had to buy a new dress. He opted for option 1. So I started thinking about it differently. And sometimes I think we just need to think differently about how you all can help us be innovative in the way in which we're looking at our health care. There was a time in my life where I would run, I don't know about you all, but I didn't look at fitness as something that was fun. I would get up in the morning, perhaps like some of you, at about 4:30 in the morning. I'd put on my sneakers. I'd make just enough noise in the bedroom so that my husband would know that I was getting out of bed. Because I was going out there because someone had to stay healthy to take care of this family, right? So I'd get out there, I'd run, and I'd really struggle getting past 2 miles. It was really hard for me. So finally, one day, my husband sat me down and he said, you know, you just have to admit that you really do like running. I said, what, are you crazy? I don't like running. He said, yes, you do. You have to admit it. And I thought about it, and I thought, so what's getting in my way? What's the barrier for me being healthier? Well, what it was, I don't know, I'm not quite as old as Larry, but not far behind, so just to kind of give you an idea. And I played basketball when I was growing up. As a matter of fact, I played basketball on the first women's basketball team in my school. And every time I missed a free throw, guess what happened? I had to run. Yeah, and I had to run a lot. So I'm not the best basketball player. There's a reason why you don't see my picture all over the place. So I ran a lot. So I looked at running as a punishment. And so if you leave here without anything today, shift your thinking. Shift it to, my thinking about it is, I'm doing this for me, not for my husband, not for my kids, but I'm doing it for me because it helps me with my stress. How many of you have stress in your jobs? Yeah. How many of you stress in your lives? Yeah. I have 6 children. I have seen it all. I can help you with this. Yeah, so I can share stories. If you want stress, I can give you some of mine. But if we just think differently, so leave today and take with you that you're going to think differently about your own wellness. It's got to start with you. And when people see you happy and you healthy, they become curious about what happened there. And then they, too, want to be part of that. So now, needless to say, my knees are a little bit worse and I don't run, but I easily get the opportunity to work out at least 5 times a week. We also know that when we take an active role in maintaining our health care, our own personal health care, our risks go down. That's why I'm here today to share with you that our university leaders are committed to this. As a matter of fact, Joe Ludo mentions Bern on a very regular basis when we're in meetings. He says, all right, everybody, we're going to take a break. We're going to walk around. He does this because he understands the impact that just taking that break can have on the outcome of the meeting and on us as individuals. So he works with us to make that happen. So as we go forward, please know that we're going to continue to take steps to focus on creating a healthy culture, creating a culture of well-being, offering you as much as we possibly can to help you stay healthy. But we need your help. We need you to stay committed, stay focused, and stay positive about what we can accomplish together. Thank you.
How many of you have tried to change the behavior of somebody you love? Yeah, I think we all have, but we all know information alone doesn't usually lead to behavior change, no matter how horrible the statistics are. So we thought this state of health and wellness, we would bring somebody up to share a personal story with each of us about his wellness journey. Because really, most people make behavior change when crisis happens or their emotions are raised. So I'm really excited to bring up to the podium now Kevin Donahoe, who is going to share some of his wellness journey with us. Kevin.
Well, good afternoon, everybody. My name is Kevin Donahoe. I work in the Office of the Chief Information Officer. It's an honor to be sharing my story with the university leaders and Buckeye wellness innovators that are, working day in and day out to make us the healthiest university in the world. So before I start, I applaud all of you in your efforts. So now you're probably asking yourself, why did they ask this average guy to come up and share his story? I had the same question myself when originally asked. And I think what it gets right down to it is I represent that typical male who thinks they're healthy and doesn't need to make a change, but when in reality they're not focusing on about 8 of the 9 pillars of health. So that's going to be my story about when I realized I needed to make a change and what I did. So my story, grew up in rural Minnesota, camped every weekend, pretty active kid, hiked, biked, swam. The different seasons meant different sports: baseball, football, hockey, snowboarding. It's a long winter in Minnesota. You get lots of time for the winter sports. After high school, I went to the United States Air Force Academy, which, as you could imagine, lots of physical activity there, both directed upon you as a cadet as well as intramural opportunities. So always been a pretty active guy. It wasn't until after college that I really realized I needed to start going to the gym and working out. And frankly, it wasn't because I had grand notions of being fit or trying to improve my health. Basically, I just wanted to keep playing sports, and I knew that if I didn't stay physically active, I wasn't going to be able to hang when I went out west and went snowboarding in the winter. So that's really what it boiled down to. The problem with that is that I was missing, again, pretty large aspects of my health. And for me personally, that was my cholesterol and my diet. So a little bit more about my background. The Donahoe men have been plagued with heart disease for a long time. My grandfather passed away when he was 45 of a heart attack. My 2 uncles and my father, the first generation of Donahoe men to live into their 50s. But in their 50s, both of my uncles have had bypass surgery, as well as my dad has had heart disease and been treated for high cholesterol. So, I'm seeing the writing on the wall. I know I've got high cholesterol, and I've got to do something about it if I want to be around to live an active life and be there for my daughter and hopefully grandchildren someday. So after years of having my biometric screening and for my personal health assessment and ignoring the fact that I had high cholesterol and turning down the offers to have a health coach, one year I finally said, yes, I will take you up on the offer to have a health coach. And if Lindsay's here, I'd love to meet her. I only ever talked to her on the phone. She was really nice. But it only took Lindsay about 15 minutes to figure out what my problem was. I was a pretty hearty northerner, eating lots of red meat, high in sodium and fat, make deli sandwiches every day for lunch, eat some variation of steak, cheeseburgers, you name it, for dinner. And she called me out on it and said, hey, I think we can make a big difference in a short amount of time without having to drastically change your diet and really make a hardship. So she recommended, again, just swapping out salami and pepperoni and corned beef, which I absolutely love, for things like turkey and chicken. For dinners, swapping out the steak and cheeseburgers for things like fish, chicken. So again, I was not being asked to do a mountain. I mean, it was very reasonable changes she was suggesting. So with the help of my wife, who helped me out with the meal planning and the grocery shopping, which I appreciate, and Lindsay's continued coaching over 6 months, I returned to my biometric health screening, hoping to see an improvement on those levels. And frankly, I was amazed. Before, I had been well over the recommended 200 level on my total cholesterol at about 225. And in just 6 months, I got it down to 165. And again, all I did, yes, thank you. And again, the changes I made were not drastic. It was just kind of coming to that realization that, I'm not the healthiest guy out there and I need to make a change. And, the programs that we have here at Ohio State, really changed my life. And, again, will hopefully allow me to live a long, healthy, and active lifestyle. So with that, my journey has only begun. As you all well know, this being healthy and well is a lifelong commitment. And it's absolutely fantastic that we have programs like your Plan for Health and the Buckeye Wellness to give average guys like me the tools they need to stay on track, continue to improve their overall health, and again for everyone, just being the healthiest university in the world. So I love being a Buckeye. It's great being a part of such a wonderful institution, but it's even better how committed our leaders are to really improving the overall health and well-being of each and every one of us. So I appreciate you taking the time to listen to my story. Hopefully, it will help you inspire others in your quest. And again, thank you for everything you do day in and day out to help us be healthier. So thank you, everyone.
Well, good leaders are blessed by putting great people on their teams. And I think I have the best team in the whole world. But a person who's been so instrumental and is right by my side all the time, you know, every day to promote health and wellness is Megan Amaya, our Director of Health Promotion, and she is actually going to introduce the Buckeye Wellness Innovators who were the most innovative this year in their efforts.
That is not necessary. So we have a lot of innovators in the audience, but for those of you who are unfamiliar with the term Buckeye Wellness Innovators, they are our wonderful, fantastic, every adjective you can think of to describe wellness team here at OSU that are not only dedicated to what they're doing in their roles, but they also think outside the box, and that's why I'm up here right now. They are composed of medical center faculty and staff, as well as non-medical center faculty and staff. They work to implement the One University Health and Wellness Strategic Plan. They encourage their colleagues to participate, and they also plan wellness activities for their own departments and units, which is a little different than other organizations. So we've taken them a little step further than a lot of other places out there. This year, a challenge was given to our innovators to create innovative and fun and exciting wellness activities for their units. So I'm here to recognize 3 of those winning teams today. So what I'll do is I'll bring them up here one at a time. I'll say a little something before each one of them, and then we have a plaque for them, which okay, thank you. And also, they are getting some wellness funds in their own departments to help them do some wellness activities, which they are very much appreciative of. So the first group I would like to recognize is the Student Life Innovators. And the group consists of Don Stenta, Libby Metzler, Jonathan Nutt, John Shearer, and Aubrey Smith. Don's going to come up and tell the group a little bit about what they're doing. I'm going to leave that to the experts of what they're actually implementing. But please welcome Don as he comes up and tells us a little bit more about what they're doing.
Thanks, Megan, and hello, everybody. I'm Don Stenta. I'm the Director of Rec Sports with the Office of Student Life, and it's my pleasure to speak on behalf of the Student Life Wellness Innovators. I think 2 things are themes that we take into consideration. One is this concept of partnership, and the other one is this concept of removing barriers. So essentially what we've tried to do is offer opportunities for 3 of the 9 dimensions of wellness. That's where we've started. And we focused in on physical wellness, financial wellness, and emotional wellness. We're looking forward to continuing our programming across all 9 dimensions of wellness. And most recently, we focused our efforts on PHA screenings for your plan for health. So as you can imagine, Student Life is an extremely large organization, and one of the things that we need to take into consideration is that not everyone in Student Life works 9 to 5 or 8 to 5 Monday through Friday. We have multiple varying shifts, and we also have people who are either completing a high school education or have a bachelor's degree, master's degree, and beyond that. So it's a very diverse community, and we have to take that into consideration with our programming. And so we're thinking about where we offer programs, what time we offer programs, and what is it exactly that our constituents need. I think the most effective thing that we tried to do this summer, after the summer's series of programs, was to actually conduct a survey to find out what kinds of programs and activities would you like to see that would make us continue to facilitate your healthy habits. So this coming fall, we will be having a healthy eating session prior to the holidays, and I think that will be an opportunity for our folks to really be thinking about, December comes around and everybody wants to celebrate, but how can we do that with a more balanced perspective of that? Some of the barriers that exist are talked about pretty consistently. We had a group of students 2 years ago approach Rec Sports and say, you offer all these great fitness classes, but there's an extra fee on top of the mandatory Rec Sports fee. Is there something that can be done about that? So we spent some time in Rec Sports taking a look at what would happen if we removed the fee. So we didn't want financial barrier to be one of the barriers that might inhibit someone from participating in group fitness. So back in the day when we would charge for group fitness, we would have about 700 people purchase a fitness pass. And that's a pretty good number of folks, right? In the first year that we lifted the fee, we had over 13,000 people at Ohio State indicate their interest in participating in group fitness. We went from offering 70 classes a week to now 105. And we went from having about 12,000 participations to last school year over 60,000 participations in group fitness in our department. That's inclusive of faculty, staff, and students, people who are members in our department. And that's amazing, right? Now, we can't lift all barriers like memberships to rec sports. We have a really, really healthy mortgage that we're paying off till 2030. The RPAC wasn't just built for free for everybody, unfortunately. But what we can do is think about free group fitness classes. So I invite all of you to take note of this. You can check this stuff out on our website, recsports.osu.edu. But for all of you who are fans of Harry Potter, on Halloween, we will be having the Flight of the Hippogriff Cycle class, or the Hogwarts Dance Party that evening on Halloween. If you're a big Broadway fan, on November 5th, we will be featuring the Broadway Lights dance class. On November 24th, which starts off Beat Michigan Week, we'll be featuring the Beat Michigan Cycle Relay. We had to go to a conference up in Michigan back in May, so we took a GoPro camera on the van, and we videotaped the entire journey. So this cycle class is going to be like you're physically going to see the way to Ann Arbor on the screen. And then to chill things out in December, we're going to be offering our second annual Downton Abbey yoga class. So that music should calm you, although it stresses me out a little bit because there's a lot of drama on that show. But the music will be a great way to feature that yoga class. The other thing I'm excited to tell you about is that this year Rec Sports is celebrating our centennial. We were founded as a department in 1913. And so next Friday night, we will be featuring a great event at the RPAC at 5:30. We invite you to come by and check that out. So lifting the rec sports fee is a great example, the fitness class fee is a great example of this concept of what's a major barrier and how can we change that. We've also done surveys about non-users to rec sports facilities, and we've asked folks, what are some of the problems that stand in the way? One thing that we get back is parking. Another issue that we get back is people don't have time. So I can influence things like free group fitness class. I can't necessarily build a new parking garage near the rec sports facilities or add more time to the day. But those are the kinds of things that we're going to continue to struggle with and try to figure out how can we do the best job in making those things happen. Our programs in student life, that's just one snapshot of things that we do. We have partnerships with the Student Wellness Center, with the Multicultural Center, counseling and consultation, residence life, and student activities. And so we look forward to continued opportunities to plan programs like this with our university partners. So thank you very much. It's an honor to be part of the Buckeye Wellness Innovator team.
Okay, our second winning team are the Buckeye Wellness Innovators from the office, OCIO. And that is composed of Margaret Queen, Jim Kittle, and Irina Ostrava. So I'm going to ask Margaret to come on up to tell us a little bit more. If we could please give her a round of applause for all they're doing. She was one of the culprits behind the surprise earlier. Thanks again, Larry.
It's an honor to be a part of the Buckeye Wellness Innovators throughout campus. Congratulations to all of you. What you do on a daily basis, monthly basis, annual basis, makes a big difference in people's lives. So congratulations to all of you. And I need to come after that speaker, the one that just left. Oh my gosh. Okay, yeah. Anyway, I'm going to go to some of your programs. Where'd you go? Oh. So some of the things that we're doing. Irina, would you mind joining me? Is that okay? Yes. Okay, great. Thank you. This is Irina Ostrova. Right. She's a team member as well at the Office of the Chief Information Officer. We're located out at Airport Drive Center, so that's kind of a barrier for us to get to campus, take advantage of all the wonderful opportunities that are on campus. So we bring those opportunities out there, about 15 minutes outside of campus. So we have yoga. Irina's spearheads yoga Thursdays from 12 to 1. Come join us. Contact Irina. We also have wellness walks. That's one of my favorites. I lead the morning and the afternoon, and Arena leads the mid-morning or midday. And so the morning and afternoon are 15 minutes each, and the midday is about 20 minutes each. So people join in, you know, we go take a walk, we talk with each other, we get to know each other, we laugh, we team build. So I love that activity. And it's easy. You throw on your tennis shoes. They usually beat me to doing that and say, Margaret, it's time to go for a walk. Okay, so anyway, it's a really great activity. We've had Spring Fling, Healthy Potluck, and is that the healthy holiday luncheon that you're getting ready to plan in December? Yes. Awesome. So again, come join us, contact us. Come on out and visit the Airport Drive Center. We would also like to thank OCIO leadership. Without them, their encouragement, they empower us. You know, we just do it because they let us. So you can't get any better than that. And is that all we have? Yes. Can you tell it's really not, I'm not good at public speaking. Great. But anyway, thank you.
Our last group we're just going to recognize. I'm going to tell you a few of the activities they've been planning. I'm going to recognize Seven Ross over in the Medical Center, Ray Jean Fox and Judy Haynes, who I'll bring up in a moment to get your plaque. So some of the things that Seven Ross has been doing, they actually went kayaking down in Hocking Hills. Their group of colleagues did, which that sounds really fun. They raised over $200 for the American Heart Walk by having a healthy taco event. Who doesn't like tacos, right? Monthly newsletters. They have a healthy recipes, exercise, different activity bulletin board for their staff members to check out. And they also are starting a book club in December. And I like that idea because it's a little bit different from your traditional wellness activities. It gets into those other dimensions of wellness. So we'd like to say thank you to all you're doing as well, and come on up and get your plaque, and please give them a round of applause. So thank you to everyone.
So since our philosophy is not to stress in what we do, and if I followed the rest of the slide presentation right now, we would be here at least another half an hour. And so we're not going to do that. We're going to adapt and adjust so we can finish recognizing the folks who won the amazing race that we had here on a very hot day in August. You can't believe how these teams came out. They were dressed in team clothes. They had fabulous names. So right now, I'm going to recognize the 5 winning teams of the amazing race. And I want to really give kudos to Ben Van Trees because he was the mastermind. He was the mastermind behind the amazing race. So these folks are getting gift card prizes. So when I call your name, if you can come up to the stage, that would be great. Now, the first team who won, place number 1, the Ladies and the Tramp. And they cannot be here today, but we'll make sure they get their prizes. Second place, Collard's Babies. So I know there's people here, yes, from that team. No? Okay. I do see folks from Wellness Emergency Department. So Tim Radersdorf, Jason Walsh, Aaron Farrell, and Steve Thatharis. Will's financial team. Do we have folks from there? Come on up. Margot Sandler, Sherry Griffin, David Hutzel, and Libby Meltzer. And last but not least, the Amazing Race groupies. Are you here? Joe, Leah, Ashley, Jen Lape. Congratulations. If you miss the Amazing Race, we're planning another one for the spring. So start lining up your teams. It's going to be another fabulous event. Okay, we're going to fast forward the slides now because we'll put up the slide presentation. You can kind of see the rest of the slides, but I really want to end with a motivational movie clip. Now, how many of you remember the movie Cool Runnings? Yes. It was about a Jamaican bobsled team, right? Now, how unlikely that a Jamaican bobsled team would actually make it to the Olympics. So I want to finish today by showing you, after practicing in a go-kart, I actually had 2 clips. We're only going to watch the last one. After wrecking in go-karts, going through a ton of character builders, look how this team pulls together to finish this particular race. Then can we flash to the very last? Okay, so while Ben's doing that, I have one last story I'm going to share. Can you all see this? It's a little bunny in front of a big bundle of carrots, and it says, "Dream big." So anytime I undertake a really big dream, I'd always say to people, take one bite of the chocolate elephant at a time. So now I have a healthier version of the chocolate elephant. But there's more to this story. So when I was dean at a college at Arizona State University before I came here, my college used to run 5 nurse practitioner managed health centers in the Phoenix area. And every year we had an event, and that event was called Art for Health. So we'd get young artists to bring paintings, we'd sell them. Half the profits went to the young artists, and half went to our nurse practitioner managed health centers. So this painting was up on the wall about 4.5 years ago. And I walked into the event, and people came up to me and said, "Bern, you're always encouraging us to dream big. And there's an artist who made a painting for you this year. Walk around and go buy that painting." So this little tiny painting was up on the wall. I took it off the wall. Of course I was going to buy it. I looked at the price on the back. How much would you pay for that? I heard $10, $50. It said $600. I said, man, that artist had a really big dream when she put that amount of money on this painting, but I bought it, got the copyright of the artist, and now we make posters of this to remind people, dream big, but yet take one bite of the bundle of healthy carrots at a time. And I have a poster for each and every one of you if you want it today, and you can pick it up on your way out. Thanks for coming, and again, go Bucks, be healthy.